Oral immune therapy is the practice of using mother's own breast milk to provide mouth care for her baby. It is done simply by placing a small amount of mother's breast milk on the inside of her baby's mouth. This easy and effective intervention is a standard of care for babies who are unable to feed by mouth. Human breast milk contains many factors that protect babies from infections or infection-related conditions. When mothers have skin-to-skin contact with their babies, they produce protective antibodies that can then transfer into their breast milk. These antibodies can provide their baby with specialized protection against harmful bacteria. All breast milk contains valuable immune and growth factors as well as nutrients. There are significantly more immune factors in colostrum, the milk that mothers produce in the first few days after birth. Your milk is specifically tailored to your baby. For example, if your baby was born prematurely, your milk is specially designed to meet your baby's unique nutritional requirements. Hand expression is often very effective at removing colostrum in the first few days after birth. Please watch our video on how to establish and maintain a breast milk supply for instructions on how to hand express your milk. Babies born as early as 23 weeks to 18 months of age who cannot feed by mouth should receive oral immune therapy. Babies experience many benefits from oral immune therapy. They often receive a boost in their immune system, providing both local and systemic protection. They begin feeding and reach full feeding sooner and experience enhanced growth. Oral immune therapy also provides positive oral and sensory stimulation for babies. Combining your breast milk with your baby's saliva creates an environment that reduces harmful germs and boosts healthy bacteria in your baby's mouth. This good bacteria creates a healthy oral environment and travels to the gut to support its healthy development and protection. When breast milk is placed on the inside of a baby's mouth, it is absorbed into the baby's body, and the breast milk's immune components boost the baby's systemic immunity. Research suggests that this practice can help protect a baby from developing infections and harmful inflammation. Breast milk also helps to develop babies' taste buds, which can increase their acceptance of a variety of flavors as they grow. Parents also experience many benefits from participating in providing oral immune therapy. Mothers may experience increased attachment and bonding with their babies. Parents feel more involved in their baby's care. It provides a strategy for parents to comfort their baby. And oral immune therapy has shown to lead to higher breastfeeding rates. This is a simple and safe activity you can do for your baby that will provide tremendous benefits.
Mouth care with mother's milk should be provided after suctioning procedures are completed and as often as every 4 hours as part of a baby's routine hygiene care. When possible, use fresh breast milk for mouth care. You can give your nurse a small amount, up to 1 to 2 milliliters of breast milk after each time you pump, to be used for this purpose. When you need to spend time away from the hospital, put aside 5 milliliters of breast milk in a white-topped container and bring this to your nurse at the bedside. They can then refrigerate this to use over the next 24 hours or until you return and can provide fresh breast milk. If you need to be away for more than 24 hours, you can leave 10 milliliters of breast milk, which can be refrigerated for up to 48 hours. Always be sure to label your breast milk with your baby's patient ID label and a mouth care label. In the first couple of days after birth, it is normal to get only drops of colostrum. This can be collected in an oral syringe, which you can get from your nurse. You or your nurse can provide oral immune therapy. We encourage you to participate in this important care for your baby whenever you can. Obtain a mouth care package from your baby's nurse, which you will use to paint the breast milk on the inside of your baby's mouth and lips. With freshly expressed breast milk, dip the first swab in the milk, open your baby's mouth, and gently paint the inside of their cheek with the breast milk. Once you have placed the swab into your baby's mouth, do not re-dip the swab into the container of milk. Repeat this process on the other side with the second swab. If you have collected your colostrum in a syringe, simply apply a few drops onto each of the swabs, then paint the inside of the mouth and lips. If your baby is in an isolette and the milk has been refrigerated, dip both swabs into the milk until saturated. Then place both swabs back into the packaging. Place this package of milk-soaked swabs into the isolette for 5 minutes to warm the milk before administering the mouth care. In the case of refrigerated syringed milk, place the syringe in the isolette for 5 minutes before applying the drops on the swabs. Many babies will start to suck on the swab or on their breathing tube during oral immune therapy. This is an expected response and often provides comfort for the baby. Please tell your nurse when you have provided oral immune therapy so that it can be documented in your baby's chart.